Hello, good afternoon. I'm Dr. Arjuman, one of the resident medical officer working under Neurology Department in SL Raheja. And here we have with us Dr. Sreelakshmi N. She is a consultant neurologist and epileptologist under SL Raheja for this associate Mahi. So I would like to give you some introduction regarding Dr. Sri Lakshmi. She's a dedicated neurologist with a strong academic and clinical background. After completing her postgraduate training from National Board of Examinations, she subsequently pursued DM in neurology from Amrita Institute of Medical Sciences, Kochi. She then underwent a postdoctoral fellowship in epilepsy, gaining proficiency in the management of complex drug resistant epilepsies. Apart from clinical neurology, she is also well versed in a range of advanced neurodiagnostic tools, including long term video EEG monitoring, intraoperative electrocorticography, and invasive modalities such as stereo EEG. So, please welcome Dr. Sri Lakshmi, ma'am, to the Facebook Live. So today's topic is breaking the stigma of epilepsy. I would like to say a few words about epilepsy. So epilepsy is one of the most common neurological disorder affecting 50 million people worldwide. It is one of the most misunderstood diseases. People with epilepsy not only have seizure or fits, but they also go through the burden of stigma, discrimination, and social isolation. Today, we are here to understand the condition better and try to break the stigma. So, let's start. Uh, Ma'am, we would like to know what is epilepsy and what is seizure of fit. Is there any difference in these terms and how does it occur?
Thank you, Arjuman, for the introduction. Seizure is a condition, or fit is a condition wherein there is an abnormal electrical activity in the brain, which will lead to alteration in your consciousness or your movement or a behavior. But when these seizures occur recurrently, unprovoked, without without a definite cause, so then it becomes epilepsy. For example, a seizure or a fit could happen due to low blood sugar, a fever, or any brain infection, anything of that sort. But when these fit occur just continuously, recurrently, without any of these provoked causes, then it becomes a chronic neurological disorder called as epilepsy.
Okay. Thank you so much, ma'am, for differentiating the terms. And what are the different symptoms that a patient can present with epilepsy?
So there are actually two kinds of epilepsies. One is a generalized epilepsy and one is a focal epilepsy. So the
Okay.
generalized epilepsy is a condition wherein you have abnormal electrical activity coming from all the part of the brain together. So there is a generalized seizure. So that is what we all like really know about it. Okay, the patient falls down, he is like his body is stiff, he's jerking, there is urinary the patient passes urine unknowingly. Sometimes he will also defecate unknowingly. There is a frothing from the mouth, and there is a head injury also. This is what we all know as like an epilepsy or a fit. Okay,
Okay.
but the thing is that there are other kind of epilepsies also known as focal epilepsy, which
Okay.
predominantly start in one part of the brain and then they could become spread to the other part of the brain. Something like a forest fire. It kind of starts in one part and then spreads all over. So the focal epilepsy is the symptoms really depends upon which part of the brain it gets involved in. If you have a seizure which is originating from your visual area, you will have you will tend to see something like a strange things in front of you. If it comes from your hearing area, you might hear some different things. And if you can even have sometimes a strange sense of smell or
Mhm.
strange feeling like a fear or something like that, or even it could be as innocuous as a strange premonition that it is going to happen. And there
Okay.
could be other kind of seizures like staring spells. The patient is working, doing things normally, and suddenly he gets stuck. He just stares into nothingness, and then sometimes he might have some lip smacking, some chewing movements or anything. or it could even just manifest as a brief period of abnormal behavior. So the epilepsy symptoms can be really varied, Arjun.
Okay. And ma'am, what are the common causes of this condition?
So the common causes of a seizure or a fit per se is could be many things. It could be like a fever, low sugar, low calcium, magnesium, or any something like a bleed in the brain or any active infection. They all could cause a seizure. But when it comes to epilepsy, it is predominantly generally happens due to a lot of structural causes in the brain, or something like a scar epilepsy. For example, if you have a scar in your skin, it just remains there as a cosmetic disfigurement, right? But if there's a scar in your brain, there's a rewiring of your circuits which will cause epilepsy in the brain. So that could be like, you might have had a trauma years back, the scar remained in the brain, and that can get rewired and you can have an epilepsy. In children, it is very common. A lot of places, when the child is born, there is a hypoxia, or what you call as when there is decreased oxygen in the brain during the delivery process, if it's a difficult labor. So the children brain will get injured because of lack of oxygen, which will lead to epilepsy. Similarly, there is something called as low sugars. Small newborn babies do not have so much of glucose reserves in the body. So if they are not fed properly, the blood glucose levels can drop inside the brain, and it can damage the developing brain, leading to epilepsy later in life. Then there are, of course, a lot of genetic conditions also, which could lead to epilepsy.
Okay, ma'am. And when a patient comes to you, there must be like what are the diagnostic tools that you apply for the diagnosis, and how is it treated?
So the first thing that is very important in epilepsy diagnosis is a history taking. So we all have to sit with the patient and their caregivers to understand and what is the timeline of the events which led to this epilepsy. I mean, what were they doing at that time and how did it manifest? A lot of time, the patients do not have consciousness,
Mhm.
so the caregivers or the primary witness account is really essential to understand what kind of seizures, I mean, what kind of event was they, whether it is really a seizure or something like just a passing out or an unconsciousness. Nowadays, we have, if they're in public places, nowadays we have a lot of CCTV footages everywhere. A lot of times, if that has been captured, we can always you know review those footages and see that. And also, if a patient has recurrent seizures, so we encourage one of the bystander to take the video of the patient seizing, because it will give you a lot of information that we might even miss by recalling the event. So that also we will encourage. So once the history part is done, then we examine the patient for any problem, and it is followed by, depending upon the situation, it might be followed by some blood investigations to rule out any cause of it, as I said before. And then we would also require sometimes an imaging. If no apparent cause is found in all these things, we will require an imaging like a CT or an MRI, etc. And then there is another investigation called as electroencephalogram, okay, or which is what you known as EEG. Now, all of us are mostly familiar with an ECG, which is an electrocardiogram, and we must have seen, we must have got it ourselves or seen someone getting it done. Okay, so EEG is also similar to ECG, wherein you put some electrodes or some stickers on your head, and we try to record the activity of the brain. The brain signals are recorded in EEG. So, EEG will tell us from which part of the brain the abnormalities are arising, and what kind of abnormalities are there, and it will guide us to give proper treatment. So these are some of the diagnostic modalities.
Okay, okay. Thank you so much for clearing everything. So, ma'am, I would like to know once it's diagnosed as a seizure or epilepsy, Are there medications for it, and are there any side effects of those
Okay.
medications?
So there are 70% of the epilepsy are medically treatable, and they have, like, medically they are very responsive to it. But in epilepsy specifically, we should have a personalized approach. The choice of medicine really depends upon this type of epilepsy, the age of the patient, the gender of the patient, the comorbid conditions, and the general health of the patient. So, depending upon that, if you choose the right medicine and give it at the right dose, considering the side effect profile also, it is, 70% of the time the epilepsy is medically sensitive, and they are generally well tolerated and safe.
Okay, ma'am. So, ma'am, there's this neurosurgery is often surrounded by myths, with the most common being that it's always dangerous, it requires a large skull opening, and it leads to long recovery periods. So, tell me, please, that when do we consider surgery for epilepsy, and how safe are they?
So, as I said before, 70% of the epilepsies are medically sensitive, which means there are 30% who do not respond to medicines. So, they are known as medically refractory epilepsy. So, there are potential options, surgical options for them for decreasing the seizure, or potentially curing them. So like as you said, there's a lot of myths surrounding the surgery for epilepsy. But in this modern era, we have a lot of new surgical options. We have minimally invasive surgeries. We have, the surgical options with minimum risk. And a lot of time, not a lot of time, most of the times, all these surgeries are done after a thorough pre-surgical or a pre-operative evaluation, where there is a collaborative approach with the neurologist or the epileptologist, epilepsy surgeon, and the neuropsychologist, and everyone together. We all sit for a multidisciplinary conference to understand from which part of the brain the epilepsy is originating from, and we have to have a consensus where, if you are removing this part of the epileptic zone, whether is it going to affect how whether is it going to affect the functional condition of the patient. So after saying all that thing, we sit with the patients, talk to them, and then make a decision. And most of the times, we can make a huge change in patient's life if the epilepsy remains medically refractory by surgical methods.
Okay, ma'am. Thank you so much. So, ma'am, I would like to share an incident of my life. When I was a child, I was going with my parents and I saw a man. He was having a seizure. So, there were people who were making him smell the shoes, like the sole of the shoe, and someone got an onion from somewhere and they were trying to, make him smell all that. So, I would like you to tell us, please, that how to manage this outside, like for common people, how can they manage when something like this happens to someone they know, or in public? So
Yeah.
please.
So this is a very important thing to understand, that we all, as general public, we must know what are the first aid things that to be done in case we see a patient having a seizure. Uh, the first important thing that we should always do is move them to a safer place.
Okay.
If they are like seizing in middle of the road, take them to the side so that they do not have further injuries. Remove any hard objects nearby, sharp objects nearby. If they are in tight clothes, loosen the tight clothing. Roll them to one side so that the secretions don't enter the lungs, it just flows out of the mouth. And never ever restrain their stiffness. So a lot of times the patients are stiff, we try to forcefully make it straight. It should not be done. We should not try and insert something in their mouth, which will be a lot of times counterproductive. And there is absolutely no role of giving some onions, or giving some keys in hand, etc. Most of the time, epilepsies, all the seizures for that matter, will subside on its own within 2 minutes. If it continues more than 5 minutes, we should actually be calling for the emergency response, and the patient must be taken to the hospital immediately.
Okay, ma'am. And thank you so much for giving those information. There's a myth and there's a taboo going on in different countries that patient with epilepsy cannot get married. So, would you like to share some?
Yes. So epilepsy is never a contraindication to get married. Of course, marriage is possible for patients with epilepsy, but I feel that open communication is the key in such cases. So
Okay.
the patients with epilepsy should tell the prospective partner openly that they have this condition and they are taking treatment for it. And very important aspect associated with this is the possibility of having a congenital defects in the baby in case the lady gets pregnant. So what we generally advise is, whenever the couple is planning for a pregnancy, they should reach the doctor or speak to the doctor even before planning for a pregnancy, so that we can, if the patient is on a medication which is potentially bad for the baby, they could alter the dose of alter the medication or give it at the lowest possible dose, and also start on supplementation of folic acid, which is a vitamin which is really important for the babies to grow. So that can be and that should be started even before they are planning a pregnancy. So, but otherwise there is no contraindication for marriage in patients with epilepsy.
Okay. And how about driving? Is that
So,
possible for?
yeah, so that is a very, there are different rules and regulations in different countries. According to the Indian law, any patient with epilepsy should not be, do not get a driving license, or we must sign an agreement telling that we do not have any epilepsy while we are trying to get a driving license also. uh, so according to our law, we are not, people living with epilepsy are not allowed to drive, because they are a danger to themselves, and also they are danger to others also on the road. So that is the thing. But then there are countries which allow people with epilepsy to drive, if they are seizure free for a certain period of time, and they get a certification from the neurophysician. So each country has their own laws, and if the epilepsy is controlled, it's better not. It's uncontrolled. It is better not to drive
Okay.
vehicles.
And ma'am, we see a lot of children with epilepsy, and sometimes it gets very overwhelming for the parents to take care of them. So, what should parents know, and how do they take care of them?
So, tackling children with epilepsies can be extremely challenging. First of all, we should have an accurate diagnosis. We should have the apt medications at the lowest possible doses, and there's a lot of help that need to be given to the child as well as the parents in this case. Children, if they are bigger, as they grow bigger, they should be taught about the condition, and if their epilepsy is such that they are able to identify any premonitory symptoms, they should be taught about it and told to express it if they are feeling any of those, and they should be given a conducive environment in the schools or their study areas, so that they can thrive like a normal children. And it is very important to encourage normalcy in children, except that they are just taking medicines.
Okay. And what are the factors that can trigger epilepsy, and what precautions can we take?
So one of the most important factors, one of the few important factors which trigger epilepsy is, lack of sleep. Having a good sleep hygiene is very important. Even for patients without epilepsy, it is important, but more so in patients with epilepsy. Having a good sleep hygiene is very important. Second is, do not miss medications. If the patients are on any medication, they are not supposed to miss any medications. Sometimes flashing lights like a disco party or anything can trigger epilepsy in certain people, and factors like high fever, any infection or any stress to the body, or any of those things can trigger seizures in individuals.
Okay, ma'am. And is there any special diet restriction for the patient?
No, actually, in epilepsies, there are no specific diet restrictions as it is, but there are some dietary therapies. As you all must be aware about keto diet, that people use it for weight loss. So, similarly, ketogenic diet is effective in certain children with certain kind of epilepsies, wherein the ketones, which is produced by taking keto diet, that is, keto diet predominantly is a no carbohydrate and only fat diet. So, which on breakdown produces ketones, which is potentially therapeutic for certain epilepsies. It is not for all type of epilepsies, only certain epilepsies. So, otherwise, there is no dietary restriction for patients with epilepsies.
Okay. And thank you so much. So, ma'am, how common are depression and anxiety in patients with epilepsy? And what are the precautions that we are needed to to take?
So, depression and anxiety is a very common thing in patients with epilepsy. So, it's kind of a cycle. Depression and anxiety can result from epilepsy. We all know now that depression and anxiety has an organic basis inside the brain. They are related to some chemicals inside the brain. But when there's an epilepsy patient, their networks and the chemicals in the brain are already altered, which can easily predispose them to depression or anxiety. This depression or anxiety can also trigger seizures also in epileptic patients. So this is a continuous cycle which goes on, and it is very common to see patients with epilepsy. It is either because of these biological reasons, and a lot of times it is because of the psychosocial reasons, because patients often get stigmatized in the society, and which can lead to depression and anxiety, which needs to be countered, and it needs to be identified and treated.
Okay. And ma'am, a lot of time patient comes asking like if it's contagious, if it can be
Absolutely
contagious.
not. Absolutely not. Epilepsy is not at all contagious. It's just a disease of the brain wherein your brain has a tendency to throw seizures. It is a complete myth.
Okay, ma'am. So the final question is that can we cure epilepsy or do we have to live with it?
uh, uh, See, there are certain kind of epilepsies which go away with time. It will automatically decrease with time, and then patient can be probably considered cured. There are a lot of epilepsies can be managed really well with medications with
Mm-hmm.
minimum side effect or no side effect. They can lead almost a full productive life
Mm-hmm.
just with some one or two medications. So that is possible. And there are, if there are a certain kind of lesions in the brain which are causing this epilepsy, tackling them by epilepsy surgeries can be potentially curative in some people. So there are it kind of depends upon what kind of epilepsy are we dealing with.
Okay, ma'am. Thank you so much for giving all the information. So, is there any special message that you would like to give to the people uh, who caregivers, bystanders?
Yeah. So I would just like to say to everyone that epilepsy is not a barrier. People with epilepsy can lead complete, healthy, happy, productive lives.
Mhm.
And you should have a healthy lifestyle, take proper medication, have a good follow up. You can really be as normal as anyone in the world. Um, And I just want to say that you should seek help, you should stay informed, and we should try and break the stigma of epilepsy.
Okay, ma'am. Thank you so much for such a valuable Facebook live, and I'll take a leave from here. Okay, ma'am.
Thank you so much.
Thank you
Thank
so
you so
much.
much, Arjuna.
Well,